Welcome to Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thanks for joining us. Today on Community Health Heroes, we'll be speaking with Jim Pittman, Community Outreach Manager for the Smoking Cessation Trust, who will talk about the importance of the Great American Smokeout taking place on Thursday, November 17th. And in recognition of American Diabetes Awareness Month, Candace Cargo with the American Diabetes Association will talk about the prevention and treatment of diabetes. And join us for today's Eat Fit NOLA cooking segment. We'll be in the kitchen with Chef Jean-Pierre Guidry and Carl Schaubhut of Bacobar in Covington. So don't go away. We'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Welcome to Community Health Heroes. Did you know that smoking costs the U.S. $170 billion with a B in healthcare bills every year? Join us today to talk about the upcoming Great American Smokeout on November 17th and how you can quit for the day, for your health, and for the life is Jim Pittman, Community Outreach Manager for the Smoking Cessation Trust. Thank you so much for joining us today, Jim.
Thanks for having me. It's a pleasure to be here.
Thank you. So tell me about the Great American Smokeout.
Well, the Great American Smokeout takes place once a year. It's a national celebration, I guess you could say. It takes place the Thursday before Thanksgiving. So this year it's on November 17th. It's a day in which we and everybody involved with healthcare encourage people to quit smoking or to try to quit smoking for one day. And what we hope is that that one day that you quit smoking and you donate that money that you would have paid for cigarettes to charity, it will help not only help that charity, but also help get you on the road to quitting smoking for good.
Awesome. So it's on November 17th this year.
Yes.
That's
November
great.
17th.
So how do you approach your family, your friends, somebody that you really want to encourage to quit smoking?
Well, I think that's a good day to do it. You know, it's a little heads up. Here's a special day. Mom, dad, brother, sister, relative, cousin, whoever. You know, we're here to support you as your family member. Here's a perfect day to start. And then, of course, the Smoking Cessation Trust provides free services and prescription medications and counseling to help people quit.
And what other programs are out there? Yes, your program's out there and the medications are free, but if you need even more help, where can you go for that?
Well, funny you should ask. I just came from a meeting with Jerry LeBay, who runs Oxnard's cessation program. And Oxnard now has 20 cessation clinics throughout the greater New Orleans area on up the river to Baton Rouge. And 20 clinics, and they're about to open their 21st in Luling. Their cessation clinics are funded by the Smoking Cessation Trust. We work in partnership with Oxnard and other healthcare providers throughout the state, like East Jefferson General Hospital, West Jefferson Medical Center, Cardiovascular Institute of the South, and the list goes on and on.
Tell me about the program. You have to have a certain birth date, and how do you go about that?
Okay. In order to qualify, all you need to do is you need to, number one, be a resident of the state of Louisiana, and you need need to have started smoking before September 1, 1988. From that point, everything is easy. All you need to do is call one of our phone numbers or go to smokefreela.org and enroll, and enrolling is simple. And the phone numbers, or locally in the greater New Orleans area, it's 504-529-5665. Toll-free statewide, the number is 855-259-6346, or go to smokefreela.org.
And what kind of tips can you give people? I mean, should they get a friend? Should they quit with somebody else that's quitting? What kind of tips can you give our audience?
To not do it alone. So if you can do it with a friend or a relative who's going to be a support for you, that's always helpful. By becoming a member of the Smoking Cessation Trust, you're doing it along with 61,000 people throughout the state, many people probably in your community and in your neighborhood. Other things, get rid of those old packs of cigarettes, as soon as possible, those ashtrays. Get rid of the clothing that smells like smoke if you can. Stay out of bars and places where they still smoke. And luckily in the greater New Orleans area, none of the bars have smoke in them anymore. But there's still bars and social places that people smoke. Get the help you need. Some people need more help than that. Some people, medication, a prescription medication is helpful. Some people, we know, and in talking to pharmacists, they've got customers in Louisiana who meet the qualifications, still don't know about the program, and they might be paying $300 per month for cessation medication, and if you're a member of the Smoking Cessation Trust, it's free.
So I have a question on that. Are you also educating the pharmacists? Like if they have a patient that says, I know patients oftentimes go to the pharmacy and they say, I can't afford that. Are the pharmacists educated?
Good question. We absolutely are. In fact, a lot of what I do is identifying, connecting, and engaging with as many influencers throughout the state of Louisiana that have constituencies that could benefit from such a wonderful program. So I look for every opportunity as possible, not only to educate the large national pharmacies that exist in Louisiana, like CVS, Walgreens, Rite Aid, those, but every chance I get to educate the independent pharmacies.
Right, we have a lot of those.
I carry these cards with me everywhere I go, and am pleasantly surprised and I guess happy to see how much they want to work with us and how much they want to help their customers quit smoking. So they receive these cards with open arms, and it's just a wonderful opportunity for them, especially to help those customers that, like I say, might be paying $300 per month for prescription medications to quit, or they're paying for nicotine replacement therapy.
Right,
like
and that's covered
gums.
too, like the patches.
Gums, patches, lozenges, inhalers, those sorts of things, that can add up, and we cover it if you qualify.
So this program's not going to go on forever, so can you tell me a little bit about that?
It's a 10-year program. We're in the 5th year of the program, so we've got 5 more years to go. We've got 61,000 members. We'd like to get 200,000 members enrolled in the program. So, the time is now. So if you've got friends, relatives, neighbors, and anybody that you care about that smokes, this is the time for them to quit. There's not a better time in Louisiana to become smoke-free. There really isn't.
Absolutely. And so 2 ways to reach you are that phone number that you mentioned?
Yeah, the phone number, and I'll say it again if you're okay with it. In the greater New Orleans area, it's 504-529-5665. Toll-free throughout the state, 855-259-6346. Or online, it's simple, smokefreela.org, smokefreela.org.
And you're touching so many lives.
Yeah, absolutely. And I appreciate the opportunity to be on your program because any chance we get to shout it from the rooftops about how wonderful this program is, I'm happy to be here.
Thank you for sharing this very helpful information with our audience today, Jim. When we return, we'll be speaking with Candace Cargo, Community Health Strategy Manager for the Gulf Coast American Diabetes Association, who will be talking about the prevention and treatment of diabetes. So stay tuned, there's more Community Health Heroes.
Where are you headed?
Just gonna hang out.
If any of your buddies ever pressure you to take a drink, just tell them you promised your dad you wouldn't.
I promise. Love you too, Dad.
They really do hear you. For tips on what to say, visit underagedrinking.samhsa.gov.
Did you know that Louisiana ranks 39th in the nation for the prevalence of diabetes? While this is an improvement over 2014 when the state ranked 45th, much work is still needed. Joining us today to talk about the prevention and treatment of diabetes is Candace Cargo, Community Health Strategies Manager for the Gulf Coast American Diabetes Association. Welcome to the show, Candace.
Hi, thank you for having me.
So tell me, what are some of the early symptoms of having diabetes?
So we get reports, most reports come in the form of saying people have issues with frequent urination, they're increasingly thirsty. We do have a lot of people tell us that they're tired. Towards the progression of the disease, people will see slow healing of cuts and wounds and some kind of burning and tingling in their feet as well.
And so why should somebody seek treatment at that point?
At that point, you know, so diabetes is a disease that affects your entire body. So, you know, once the disease progresses, there are other complications such as, you know, blindness. A lot of people will, if it's not treated properly, it can lead to kidney failure, blockages in the leg arteries and in the carotid arteries, as well as in the heart. People who are diagnosed with diabetes are at a 2 to 4 times greater risk of stroke and heart attack. So the complications that are chronic, that are down the road, are super important to catch early on as well.
And there's some newer treatments on the market now?
There are, recently, just this week, there is a different type of insulin that is out on the market now. Of course, physicians typically describe pill form for type 2. We do have type 1 people with diabetes that will inject via, an insulin needle or with a pump. And also just very recently, they have been testing for an artificial pancreas. So lots of new research out there and lots of new products out there as well.
Now, even though Louisiana's moved from 45th to 39 in diabetes, 39 is still pretty bad. Why do you think that is?
You know, nationally, we have, certain criteria for risk factors. One being age, which is a very broad risk factor. Another being gender, and I think, height and body weight and BMI play a large role, as well as family history. So I think, a part of it may be our culture. A culture that's based around food and drinking and stuff like that. And then, another part of it could potentially be an educational piece. I mean, things are not the way they were 20 years ago. Diet has really shifted. There's a lot of new stuff out on how to read dietary labels and what are the physical activity recommendations as well. Louisiana is making moves towards a more green environment where people can take their bikes to work and stuff like that, but we're not leading the nation in that area. So I do think that those are all major factors besides our regular risk factors as well.
So I'm hearing more and more doctors now tell patients that they're pre-diabetic, and I know in the old days they were sensitive. They didn't want to even tell a patient they were diabetic. They didn't want, the whole fear factor going on. So what do you think is causing that?
Well, once again, I definitely think it's heavily, lifestyle factors. And right now, currently, we have about 86 million Americans who have prediabetes, who have been diagnosed, as you said, with prediabetes. And we're finding that about 1 in every 3 patients don't even know that they have prediabetes. So we have to kind of take a look and say, all right, well, what can we do to help people, and educate them on, where their glucose levels are and where they need to be.
Absolutely. So what kind of diabetic programs or pre-diabetic programs are available in the state?
There are a few DPP programs is what we call them. They're diabetes prevention programs that are in the state of Louisiana. Diabetes prevention programs are actually CDC certified. You can find them around the state at health and wellness centers. Some hospitals host them. Some YMCAs also have them. I know in particular the association is working towards hybrid programs. So currently we have a program in place for children who are at risk for type 2. We just launched it this summer. It's a summer camp, and it teaches kids the importance of physical activity and nutrition, and also, you know, lifestyle change. And then next year we're hosting a hybrid DPP program for seniors, so for older adults. So there are DPP certified programs, and there's also, you know, hybrid models out there, and these programs are shown to actually work. You know, when you enroll in a program like that, typically you are assigned a lifestyle coach who coaches you for an entire year on different factors that play roles in, you know, once again, diet, and I always say diet and exercise, but diet and exercise, and some of the ways to manage stress, even to the factors that play a role in prediabetes and developing prediabetes. So.
And you didn't used to hear about children getting type 2 diabetes, and I heard that you mentioned that. So tell me about that. Is that epidemic in Louisiana? Is it just gently rising? I mean, is it something we should be concerned about?
It is definitely something we should be concerned about, and I think childhood obesity is also on the rise as well. And, you know, we as an organization, once again, have to try to cater to the material that we're trying to teach to the schools. We have a Healthy Kids program that we just launched this year. It's geared for K through 12. You know, it has fun activities for the kids. It's more education based for the older children that are in high school who can really truly understand what diabetes is. But once again, you know, it's all about the education at this point. You know, we want to also send information home for the parents as well. So it kind of kills two birds with one stone.
Yeah, because it's really a whole family lifestyle that needs to change.
It's true, and it's not an overnight thing. It's not a quick fix with a pill. It's definitely something that it takes time to not only just change, but to continue, you know, for
make
the
a
future.
lifestyle change.
Right, completely, absolutely.
So where can we find more information about your association?
We are located at diabetes.org, real short. You can find Louisiana. All of our information is on there. Myself, any kind of questions about our programs that we have a program for kids with type 1, which is super interesting to see them all kind of come together because they share this one common you know, thing that they're going through together. And then we have our new camp for kids with type 2. Our seniors program is going to be launching in 2017, right off in January, kicking the new year off well. So we have a lot of programs in place, and then if we can't answer anybody's questions, we have a national call center, which they are the best. They are the professionals at diabetes, so we can always connect whoever has questions to them as well.
Candace, thank you so much for sharing this vital information with us today.
Thank you.
When we return, we'll be speaking with Chef Jean-Pierre Guidry and Carl Schaubhut of Bacobar and Emily Eickoff of Eat Fit NOLA when they join us in our kitchen for another exciting Eat Fit NOLA cooking segment. So don't go away. We'll be right back with more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
How do we show our gratitude for our active duty military and veterans? The Disposable Heroes Project is a nonprofit organization serving all branches of the military and their families. Their mission is to recognize, honor, and support our veteran and active duty personnel in any form of assistance they may need. Visit dhproject.org now and donate or purchase merchandise to show your support. dhproject.org. It's your turn to serve.
Joining us today in the kitchen are chefs Jean-Pierre Guidry and Carl Schaubhut of Bacobar and Emily Eickoff of Eat Fit NOLA. Thanks so much for joining us today.
Thank you for having us.
Yeah, thank you so much.
So can you tell me what the first dish you're preparing is?
Yeah, so what Chef Jean's doing here is this is our entree portion of our Eat Fit special menu. So we're actually doing 3 different options, kind of 3 courses, if you will. For the menu, for the Eat Fit menu, and this is going to be what amounts to the entree portion. So we have some beautiful yellowfin tuna from the Gulf of Mexico here. We like to use as much seafood from our backyard, so to speak, as we can, since we were both South Louisiana boys. And what we've done is we've crusted it with, you have your typical kind of sesame crusted tuna. We've kind of amped that game up a little bit, and we added some chili powder and chili flakes and different kind of aromatics to it. So what Chef did was just crust that tuna in that nice seasoning, and then we're just searing it in a little bit of grapeseed oil to get some nice color on it. But of course with tuna, as we like it, pretty much cold in the middle and nice and seared on the outside, so you have kind of contrasting temperatures and textures.
And Emily, about how many calories will be in this dish?
Yeah, so this dish is about 600 calories is what we recommend for a full meal basically, but the great thing about it is it's really high in fiber and it has a whopping 37 grams of protein, which is just really great. It's going to keep you full for a long time and not give you that crash, at the end of the day. So.
And about how many Eat Fit NOLA menu items do you have on your menu?
So we're gonna start with 3 officially. We're gonna kind of work through the menu a little bit more. I think a lot of menu items we actually have already will fit in the Eat Fit dish. And Chef Jean and I, we've been working with Molly and that whole team for years now. This is our first venture with Bacobar. But we love the program, we love the brand, we love what they're doing for the community and for the chefs and diners really. So we hope to expand it. But for right now, we're gonna do 3 dishes. We have a couple of them in front of us here as well, which we'll talk about in a minute. But Chef Jean's kind of finishing the dish up a little bit here. So what we have is we're doing basically our version of a fried rice, okay? But of course with Eat Fit, we try to avoid any white starches. So what we're doing here is actually a Louisiana long grain brown rice and quinoa, which quinoa is kind of that buzzword of the health food craze, but it actually, for this application, it gives it a great texture, it gives it a great kind of pop, and the rice, of course, again, South Louisiana boys, it's hard for us to not eat a meal without rice, but we are doing it with a little bit of an Asian flair. So we sauteed some ginger, garlic, and shallots, which kind of gives it a little underlying aromatic. We have some beautiful shiitake mushrooms, which are nice and flavorful and earthy. We're adding a little bit of lacinato, kind of Tuscan kale, which has, again, that good kind of sturdiness to it and adds a little bit of structure to the dish. So this isn't your Chinese takeout fried rice here. This is it's got a little bit more going on in terms of the ingredients and the flavors. But what we always try to do with Eat Fit is it's like, people kind of look at it like, how can I cut the calories? How can I do this and that? It's like, well, we want to take the dish first to make sure it's delicious and then kind of work backwards. And with this dish, honestly, this was one that we started off on the menu and we really didn't change it much from what you have today in terms of making it Eat Fit appropriate. So, it's always a win when you can kind of obviously not have to sacrifice any flavor or technique or anything like that and still get all that in. So we just give that rice and that quinoa a little bit of a kind of a fry, is why they call it fried rice. Get a little bit crispy, a little bit brown. He added a little bit of some nice chopped herbs. We love cilantro, Thai basil, and green onions. That's kind of our go-to herbs at the restaurant because just like the aromatics and the things they kind of bring to the dish.
Smells very flavorful.
Yeah, we deglaze it with a little bit of rice wine. And really that's it. A light seasoning. You can use salt and pepper. We use our own herb blend. Sometimes we'll finish it with a touch of soy. Of course, if we're using soy, you kind of want to reduce the salt, and that's really it as far as the fried rice goes. The other component to the dish is it's kind of a seasonal puree. So today's puree is actually going to be this is going to be a sweet potato puree. Oh, wow. So we're just going to kind of slice this guy here. Real sharp knife is always helpful. And this is about a 4-ounce piece of tuna, which we find protein-wise is that's really the comfort zone. I think any more and you're really getting a little too full, and obviously for the calorie purposes, it doesn't necessarily work. And again, fishing season is definitely upon us very soon, as is hunting season in Louisiana. So there's going to be a lot of different of those Gulf fish available, and any one of those will really probably fit within this recipe as well. Red snapper, grouper, flounder, cobia, you name it. And it can work with this same seasoning. And of course, you might want to cook those a little bit more than this one, but that's about it.
Beautiful.
Yeah, and then we have, as far as our garnishes, we like to bring a little bit of kind of a pickled element to a lot of our dishes. So this is kind of just some pickled, a variety of pickled kind of seasonal vegetables. We have some cucumbers, some carrots, some nice baby bell peppers, a little bit of mirliton, some different cabbages as well.
I think you've already pretty much hit on it, but your culinary style is an international melting pot. Do you want to explain that a little bit more?
Yeah, so, Chef Jean and I we come from obviously different backgrounds as well as different culinary backgrounds. One thing we agree on is just quality first. and technique first. So when we came together to kind of, two chefs opening a restaurant is a challenge, because his style is very much more classical and French. He trained in New York and went to one of the best culinary schools in the country. And I'm self-taught, so I'm kind of just, I read cookbooks, and it's kind of trial by fire, so to speak, no pun intended. So when we came together, it's like, what do we want to do? And then, going to Covington, we really felt there was a need for something kind of creative, something fun, something exciting, but we still wanted to keep it approachable. We still wanted to keep it family friendly. So we said, he kind of loved Latin food. I kind of loved Asian food at the time, honestly. When, throughout your career, you kind of get into different grooves of cuisine, and we took an awesome trip to Los Angeles to do some R&D for this restaurant, and we fell in love with, honestly, those flavor combinations of, they have some of the best Latin American Hispanic food there and some of the best Asian American food there as well. And so what we do is American food.
And these two dishes up here look delicious. Can you tell me a little bit about them?
Yeah, so we have, fall's up kind of upon us, even though it doesn't really feel like it outside. It is, believe it or not. So this is actually a coconut and carrot bisque, kind of, almost like a pureed kind of soup where, again, you're able to get that kind of hearty bisque, fulfilling kind of flavor, kind of stick to your ribs type soup. But there's absolutely no, dairy in it. There's no roux.
Because you use coconut milk, it takes all the animal saturated fats out. So it's a really great dish, lower calorie than it would be with heavy cream, things like that.
About how many calories is in the soup?
So this is pretty low. It's about 150 calories. Wow. So, but definitely high in fiber for a soup, and gonna keep you full longer as well. So
great. What's the third dish?
And the third dish we have is a Korean crab lettuce wrap. So, yeah, again, kind of flavors. We use kind of a Korean chili paste that has a good kind of fermented, spicy kind of edge to it. But then we cut that with a little bit of just soy and some sesame and some of those other flavors. And then, of course, beautiful jumbo lump crab meat, again, from our backyard. And then underneath is a nice little marinated salad of grilled green onions, some seasonal tomato, a little bit of a kimchi, which is a fermented cabbage that we actually make in-house, and we use a lot in different dishes as well. And then we kind of just marinate all that together with some sliced raw cabbage and some herbs again, ball it up in a nice little lettuce cup of Bibb lettuce, some shaved radish on top, and we actually, for texture, put a little fresh cucumber and crispy quinoa. Again, using that quinoa is it's kind of the workhorse of the Eat Fit NOLA program, I feel like.
So what made you guys move to the North Shore with your roots being in New Orleans and Houma?
Well, it's just kind of, we look at the North Shore again as a beautiful extension of metropolitan New Orleans. And when we were scouting kind of locations for the concept, that was one that we just felt was kind of underserved, no pun intended, in terms of what we're putting out. And again, we wanted to do something creative, something different, something kind of fun and hip and exciting, but still really approachable and really for families to enjoy. And we felt like that kind of Covington, Mandeville, Madisonville area was just really prime for that,
So exactly where are you located and what are your hours?
So we're on LA 21, just right north of I-12 between Madisonville and downtown Covington, not far from St. Tammany Hospital. Our hours are 11 to 9, Monday through Thursday, and then we're open from 11 to 10, Friday, Saturday. And then Sunday we do lunch only from 11 till 4, kind of whenever people stop coming. So.
Well, awesome. Thank you all so much for being on the show and providing this wonderful meals and dishes. It smells delicious and it looks beautiful too.
Thank you all.
And we'll be right back with more Community Health Heroes.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country. Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also subscribe to our show on YouTube. We hope that the information we provide today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.